Good afternoon and welcome again to the National Emergency Operations Center COVID-19 briefing for the 1st of June 2020. Thank you very much for joining us today for this briefing where we continue to provide you with information that is pertinent to the management of the COVID-19 pandemic here in St. Kitts and Nevis. Today, of course, is a holiday in St. Kitts and Nevis. It's a public holiday. It is what we refer to as Whit Sunday, or another name for it is Pentecost Monday or Whit Monday. And this holiday, just a little information, came about because of the day of Pentecost. Pentecost Sunday, which culminates the end of the Easter season. The Easter season is 7 weeks, so that is 7 multiplied by 7, which is 49. And the 50th day is what is referred to as Pentecost on the religious calendar. And to celebrate, because it's such an important feast in the church, which has to do with the descent of the Holy Spirit, it is termed that it is the birthday of the church, that it is the Holy Spirit that gave birth to the church. And so therefore its importance is celebrated today with a holiday, Whit Monday or Pentecost Monday. Also today, we start the hurricane season. It is the season of cyclones in the Caribbean and other places, June 1st. And the hurricane season lasts for 6 months and goes up until November 30th. We are seeing that even though we have the COVID-19 pandemic globally, of course that's what a pandemic means, it's global, that we are seeing many challenges to the protocols that have been put in place to manage or to mitigate against the transmission of the COVID-19 virus, such as the wearing of face masks, social distancing, and others. Of course, those of us who are paying attention to the news would have seen large gatherings all around the world where people feel, of course, that there is some issue of injustice, and sometimes, and there is. We've seen it in the United States with racial tensions and a lot of protests and demonstrations for days. We have seen it in Hong Kong. We have seen it in London and in other places across the globe, where people are coming together in large groups, mass gatherings, to protest. Of course, even though we have the COVID-19 pandemic, life continues. But these are some challenges to the protocols that have been put in place. For example, the wearing of masks and the social distancing protocol. And of course, it would appear that the COVID-19 virus is placed on the back burner. But these are some dangers when people come together in large groups and so on. Not only abroad, but here in St. Kitts and Nevis, we have seen, even with the political silly season, we've seen some gatherings and so on that are cause for concern. People not wearing their mask and large gatherings and so on, which of course are challenges to the very protocols that have been put in place to prevent an outbreak of the COVID-19 virus here in St. Kitts and Nevis. Today, I would like to invite Dr. Reginald O'Loughlin, who is president of the St. Kitts Diabetes Association, to share a few words with us. Dr. O'Loughlin.
A pleasant good afternoon to one and all, listening and viewing. My name is Reginald M. O'Loughlin, and I apologize profusely for the mistake Mr. Williams made in designating me the president. One of these days when I grow up, I'd hopefully, achieve such stardom. At present, I am the public relations officer for the St. Kitts Diabetes Association. And my task here this afternoon is to underline a few important issues as it relates to diabetes and COVID-19. Now, diabetes, we know, is one of those chronic, non-communicable diseases. The St. Kitts Diabetes Association, of which I am a part of, estimates that there are approximately 3,000 to 4,000 diabetics in St. Kitts. And note, I'm saying St. Kitts. It is the St. Kitts Diabetes Association. On Nevis, they have a different entity that tackles diabetes on Nevis. So our estimate is that there are about 3,000 to 4,000 diabetics. Now, what is the significance of this as it relates to COVID-19? We would have heard lots of details in relation to risks, symptoms, etc., the whole shebang as it relates to coronavirus and the people who are at higher risk for coming down with this illness and suffering serious consequences. One of the factors that has been clearly underlined is the risks associated with people who have what we call comorbidities. That's a fancy long term which I always like to break down. Now, morbid, sickness, comorbidity, that is the existence of another illness at the time of your COVID disease. And it has been clearly shown that people who suffer from comorbidities like hypertension, like heart disease, like cancer, and more specifically, since I'm here for the Diabetes Association, like diabetes, they seem to be at higher risk for facing some of the deleterious consequences associated with the coronavirus disease. So for that reason, we as a support group for diabetes in St. Kitts would like to give some gentle reminders, which we often speak about during our presentations, which take place at the Old Girls' School on Victoria Road every 3 months. Yes, believe it or not, we organize those meetings as a support NGO group here in St. Kitts to give gentle reminders, refreshers as it relates to diabetes, what to do, what not to do, and how can one stay on track to be able to avoid some of those well-known complications of diabetes, the amputations, the kidney disease, the blindness, just to name a few. Now, we at the St. Kitts Diabetes Association, we have coined a term, team. And if nothing else you remember today, after my short, brief presentation, I want you to remember the abbreviation team, but not team as in a group of sportsmen, T-E-A-M. We're talking about T-E-E-M, because that spells out the gospel according to the St. Kitts Diabetes Association. And the T stands for testing. We contend that in order to properly manage and control your diabetes, you must test regularly. The E stands for exercise. That is the first E. We contend that if you exercise regularly, you can manage your diabetes much better than without the exercise. The second E stands for eating, and we all eat. We must eat to be alive. But here we're talking about eating properly, eating wisely, following the guidelines. Lots of greens, vegetables, and fruits, and not all those cakes and those malts and those sugar-sweetened beverages which people often reach for on the first choice. And the M stands for medication. And most, if not all, diabetics at some stage would have been prescribed some form of medication to properly manage their diabetes. And when it was prescribed, no doubt it was recommended to follow a specific, disciplined approach to this medication. Not to take when necessary, as you do with paracetamol or Motrin, but rather to take in a regular, planned fashion with the discipline such that the end result would be good control of your diabetes. So we are just reminding diabetics, please follow the guidelines, remember the abbreviation TEAM, and that will give you a good chance of managing your diabetes, especially under the adverse circumstances created by the coronavirus syndrome. We recommend that you should try and have at least 4-week supply of medication at all times within the confines of your home space. Why is this so? We know that there are people who, after testing, have to be quarantined, whether it be quarantined at home, whether it be quarantined in a government facility, wherever. And so movement at that time and the ability to procure your medications would be severely hampered. So by having at least 4-week supply, you won't have the bother of wondering, where will I get tomorrow's metformin from? Or next week's insulin, because you will already have those in your stock. It's important also to have a contact person in your phone, in your notebook, if you're old school like me, such that once the need arises, that person can assist you in the procurement of whatever you may need, whether it be edibles, supplies, whether it be medication, whether it be getting something done. You must have a contact person in your files such that your life will be able to continue with the assistance of that person. So with these little pointers, I would like to recommend that as diabetics, as friends and family members of diabetics, bear all of these in mind. Remember the gospel according to the St. Kitts Diabetes Association, and when we present it in biblical form. We say, thou shalt test regularly, thou shalt exercise frequently, thou shalt eat right at all times, and thou shalt medicate thyself in a disciplined fashion. And with that said, I say thank you very much.
Thank you very much, Dr. O'Loughlin, the Public Relations Officer for the St. Kitts Diabetes Association. I now invite Superintendent Cromwell Henry, Divisional Commander for District A, to give us his report.
Good afternoon, all, and thank you, Mr. Williams. Since my last briefing on Friday, law enforcement has arrested 4 persons for breach of the curfew, bringing our total to 148 to date. The police wish to advise the general public that the emergency powers COVID regulations are still in effect. These regulations are intended to prevent the spread of the coronavirus, which health officials have indicated that the Federation is still at risk. The regulations provide for nightly curfews from 8 p.m. on weekdays and from 7 p.m. on weekends. The regulations also mandate good hand hygiene, the wearing of masks in public, as well as social and physical distancing as non-pharmaceutical means to prevent the spread of the disease or being infected by it. The other provisions, such as the restrictions on social events and social gatherings, are intended to reduce the opportunities for person-to-person contact. We trust that residents would not use the events of last weekend as a guide to future behavior. As long as the regulations are in effect, law enforcement will act appropriately to ensure compliance and that the preservation of our health and the preservation of the health of our residents. Thank you.
Thank you, Superintendent Henry. I now invite our Chief Medical Officer, Dr. Hazel Laws, to give us the COVID-19 situation report. Dr. Laws.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. My task is to share with you the Health Emergency Operating Center Situation Report for today, Monday, June the 1st. Now, this microscopic organism has tracked through so many continents so far, left Asia, Europe, North America, Central America, South America. It has impacted the Caribbean. Based on data from the World Health Organization, we have 6,057,853 confirmed cases so far, and it has caused over 371,166 deaths globally. Here in the Federation, we have been lucky in that we have only had 15 confirmed cases so far. Today we are at day 42 since we would have announced our last case. So far we've tested almost 400 persons with as many as 381 samples returning negative. Today we have no results pending. At present, we have 7 persons in a government-designated facility. They are quarantined there, and to date we have 815 persons who would have been released from quarantine. All our cases have recovered. So today we are going to focus on COVID-19 and obesity. Now, the latest information coming out of China and North America tells us that there seems to be some association with obesity and our body mass index and the severity of COVID-19. And this information is important because, as you are aware, we would have contained the first wave of COVID-19 infections, and we are told that there will be a second wave. And so it's important for us to be able to identify those individuals who would be at an increased risk of hospitalization and ICU admission when impacted by COVID-19. And so the data or the science is telling us that there is a high prevalence of obesity amongst patients with severe COVID-19. So they looked at a number of patients in China, and they found that the patients with severe COVID-19 and those who would have died from COVID-19, they had a high BMI, or body mass index, which is really your weight based on your height. So you and I, we can calculate our BMI by weighing or noting our weight in kilograms and dividing it by our height in meters squared. And so what they found is that individuals whose BMI was higher than 25, they didn't do very well with COVID-19. Data coming out of New York City in the United States suggest that obesity, meaning persons who have a BMI over 30, this might be a risk factor for ICU admission, particularly in persons who are even younger than 60 years of age. So just a little bit about BMI. If your BMI is between 18.5 and 24.9, you would say that you are at a normal weight for your height. If your BMI is between 25 and 29.9, you are deemed overweight. And if your BMI is 30 or over, you are deemed as obese. And so we want to recommend that you take all the necessary actions to control your weight and to reduce your weight if your BMI is over 25. Now, apart from your weight and the association between obesity and the severe, the severe aspect of COVID-19, even the response measures makes the situation worse, because some of the COVID-19 response measures included isolation if you were diagnosed with it. If you were a contact, you would have been asked to go into quarantine, and that's for 14 days, so your movement would be restricted. And if you are overweight or obese, this would make it worse. And again, the severe restrictions that we employed to facilitate physical and social distancing also would make obesity worse, because when we went through the long period of lockdown, we all found it, a bit difficult or challenging in terms of accessing the fruits and the vegetables and the plant-based foods that are required to eat healthily. And I dare not say we weren't able to move around as we ought to. So physical inactivity was an issue. And these factors only make obesity worse. And so now, as we relax these restrictions, all right, so now we have all days, limited operation. We can move around between 6 a.m. and 7:30 p.m. We want to recommend that you choose healthy food options. Make sure you get your 3 to 5 servings of fruits and vegetables. And most importantly, we want you to exercise in order to reduce your risk of COVID-19 and its complications. So in conclusion, persons living with obesity, seems to be at an increased risk of the severe form of COVID-19. And so prevention and control of obesity are critical and essential actions in the response to this pandemic. I thank you.
Thank you very much, Dr. Laws. I invite Mr. Abdia Samuel, Chair of the COVID-19 National Task Force, to address us. Mr. Samuel.
President, good afternoon to all, and welcome to our daily briefing today. Today I've strayed away from the usual upgraded presentation, John James. So back to normal for today. However, today I want to address our citizens and residents regarding the start of the 2020 Atlantic hurricane season. My fellow citizens and residents, I greet you at the start of the 2020 Atlantic hurricane season. I want to thank the Evangelical Association and the Christian Council for extending a warm invitation to NEMO to join in fellowship and prayer at the Antioch Baptist Church this morning to commemorate the official start of the 2020 Atlantic hurricane season. We commend the Evangelical Association and the Christian Council for making this activity a permanent one on their calendar. The 1st of June 2020 marks the beginning of the 2020 Atlantic hurricane season, and it is important that the Federation of St. Kitts and Nevis is prepared for the destructive hazard associated with this natural phenomenon. The St. Kitts Meteorological Services, who is the competent weather authority located at the RLB International Airport, has indicated that we can expect an above normal Atlantic hurricane season. The outlook predicts a 60% chance of an above normal season, a 30% chance of a near normal season, and only a 10% chance of normal season. The Atlantic hurricane season runs from the 1st of June to the 30th of November. According to the forecast, it is predicted that there is likely to be between 13 to 19 named storms, of which 6 to 10 could become hurricanes, that is with wind 74 miles or higher, including 3 to 6 major hurricanes category 3, 4, or 5, or with winds higher than 111 miles per hour. The NOAA provides these ranges with a 70% confidence ratio. An average hurricane season produces 12 named storms, of which 6 becomes hurricane, including 3 major hurricanes every year. Citizens and residents, given the above normal outlook of this hurricane season, it is vital that everyone in the Federation of St. Kitts and Nevis take precautionary measures and be prepared. As we enter the hurricane season, the National Emergency Management Agency, NEMO, continues to strengthen its public education and awareness campaign, and also mitigation and preparedness. As we embrace the our parent organization, who is the regional intergovernmental agency for the disaster management in CARICOM, which is based on Barbados. We fully embrace the principles and practice of the management, otherwise known as CDM. CDM, which is an integrated and proactive management, and seeks to reduce the risk and loss associated with national and technological hazard and the effects of climate change to enhance regional sustainable development. Let the 2017 experience of Irma and Maria, and how can we forget in 2019, Dorian, an extremely powerful Category 5 hurricane which devastated countries in the Caribbean region and the United States of America, serve as a reminder of how dynamic these weather systems can be, and that prediction can and will change. However, we must be ready, and this should allow us to build resilience as a people. We all have a role to play in doing so, and this must be of high priority at this time. their citizens and residents. It only takes one hurricane to change lives, livelihoods, and communities. And we saw that experience in Bahamas. According to scientists, hurricanes are the most powerful storms with strong winds, torrential rainfalls that can last for several hours and up to days, and has the potential to cause injury, widespread property damage, and even result in lives. As we focus our attention on the preparedness measures for the upcoming hurricane season, it's critically important that we also remember that we are still amidst the ongoing novel coronavirus pandemic. Social and physical distancing, hygiene protocols, and health guidelines to keep you safe from the COVID-19 must be taken into consideration when preparing for the hurricane season, as this will impact your disaster preparedness plans, including what's in your go kit, your evacuation routes, shelters, and more. To date, the National Emergency Management Agency, NEMA district volunteers have been making preparations, including shelter assessment and making the usual district visits, going from house to house. All members of the National Disaster Subcommittees have been working on their respective plans. Now we are getting ready to implement such. Over the past weeks, we have been providing hurricane tips to the public as part of our COVID-19 daily briefing. Now is the time for you to take action and finalize all your preparedness plans and be ready to implement them as necessary. I urge you to take action now to be ready for the hurricane season. When a storm approaches, it's too late to get ready. Again, let me repeat. When a storm is approaching, it's too late to get ready. It is important that we know the following. 1, where the emergency shelters are located. 2, areas that are prone to flash flooding. 3, emergency contact numbers for NEMA and the National Emergency Operations Center. 4, know the names and contact numbers for NEMA district managers, assistant managers, and volunteers in your community.